A University of Waikato study on the impacts of greater prioritisation of Māori and Pacific in assessing medications has increased the prescribing of new medications for Māori and Pacific peoples with type 2 diabetes. Research in Aotearoa shows the number of New Zealanders with type 2 diabetes was expected to grow by 90%. Māori and Pasifika were the most overrepresented in both case numbers and health outcomes, but were less likely to be prescribed medications, and in some cases were not prescribed any at all. Te Whatu Ora endocrinologist and University of Waikato senior lecturer Dr. Ryan Paul no Ngāti Maru Hauraki says it shows more Māori and Pasifika patients are receiving medication than ever before. We caught up with them earlier and asked what some of the key learnings of this report were.
I guess what was shown is that for all the older glucose-lowering therapies or for medications for diabetes, and what's been shown before, in that Māori and Pacific peoples are prescribed less. But here with the new medications, Jardiance and Trulicity, which had an ethnicity criteria added when they became available in 2021, that Māori and Pacific people actually been prescribed these agents more, which is great. We know they're high risk, but they're the ones that need it.
Well, these two drugs in particular, Jardiance and Trulicity, are they any different or more effective than some of the older drugs, including metformin?
They are relative game changers, in that they're probably some of the most potent agents we have at slowing down the progression of heart and renal disease, which we know that Māori and Pacific peoples are predominantly at high risk for. It's what they die from. And that's why I've been asking for them for such a long time. It's great that they're here. They also help lose weight, which for many of our whānau with diabetes is obviously something very helpful as well.
How significant do you think it is having an ethnicity criteria included in Pharmac's targeting and reprioritisation of those drugs and increasing the number of prescriptions along with the number of Māori and Pasifika taking the medication?
Yeah, it's something that's been, I guess, campaigned for a long time. I believe it's a very positive move. It was very controversial. It created a lot of backlash for many of us that were supporting it. But I really want to stress all that it does is break down barriers for Māori and Pacific people to get medications. It does not preclude other high-risk people from other ethnicities accessing their medication. It just made it easier for Māori and Pacific people. We know they have much greater barriers in accessing a health system. So all it did was even the playing field to much of an extent.
Do you feel there's enough evidence here to suggest that targeted approach towards overrepresented groups is both needed and works, and that a Māori health strategy could be more effective?
Yeah, it's a good question, Neil. I think a targeted approach is what we need. We know the health system has let down Māori pretty much since it was implemented. Here we have a way or a strategy that appears to be working. I'm a big fan of Te Aka Whai Ora. At the same time, it's very sad that we essentially need to have that to make meaningful change. But just to point out that the ethnicity criteria of the special authority was actually present before Te Aka Whai Ora was formed. So it shows what can be done, even with the existing health system.
We know that diabetes and its related conditions is estimated to cost around $2 billion to the health system. How much of an impact do you think the data in this report might have on reducing that bill?
Well, we know or expect from previous studies that are out there that these agents are cost effective. They do prevent hospital admissions and need for treatment of end-stage complications. Most of all, they prevent whānau from dying. In fact, if you look at the high-risk people with diabetes, if you treat 18 to 20 for 5 years, you actually prevent one death in that time frame. I think that's always important. Think what we're treating and saving people's lives.
Te Whatu Ora endocrinologist and University of Waikato senior lecturer, Dr. Ryan Paul, thank you so much for joining us today. Ngā mihi.